Hey, welcome back to Not So Complicated, and today we'll be talking about serotonin syndrome, its pathophysiology, clinical manifestations, and difference with NMS, right? So, in introduction, what is actually serotonin syndrome? It is the excess level of CNS serotonin that is causing a triad of symptoms like mental, autonomic, and neuromuscular, right? So, what are the causes for this? These causes are the overuse of selective serotonin reuptake inhibitors, serotonin and norepinephrine reuptake inhibitors, monoamine oxidase inhibitors, right? And they, along with, if used with serotonergic drugs like tramadol or St. John's wort, it will lead to serotonin syndrome. The synapse right here is a normal functioning of serotonin from like synthesis from tryptophan to 5-HT to serotonin, right? And the utilization, degradation, and reformation of this is seen in the like synapse in here. So in the pathophysiology of serotonin syndrome, it happens in 3 steps. The first step is that increased serotonin availability. This is the structure of serotonin, that is happiness, obviously, right? So how does serotonin availability is increased? I have talked about it earlier. First of all, SSRIs like fluoxetine blocks serotonin reuptake, and then what happens is MAOI, like MAOI inhibitors, like phenelgin inhibit breakdown of serotonin, and then again drugs like tramadol release serotonin flooding synapses, right? And combining these all, it amplifies the effect of serotonin. That is what like serotonin syndrome is. And then in second step, what happens is receptor overstimulation happens. And how is that happening? Excess serotonin overactivates 5-HT1A receptors in brainstem, causing agitation, right? And along with the other receptor, that is 5-HT2A receptors in periphery, causing hyperthermia. So in brain, it is 5-HT1A receptors, and then in periphery, it is 5-HT2A receptors, right? And these are causing, disrupting like neural and autonomic signaling. So in step 3, what happens is systemic cascade. Like a cascade happens. This is the difference between serotonin syndrome and neuroleptic malignant syndrome. The onset of serotonin syndrome is abrupt, more than gradual, and gradual then abrupt in NMS, and then course is rapidly resolving in serotonin syndrome. The font is concise that to make you remember, and prolonged in neuroleptic malignant syndrome. Neuromuscular findings, myoclonus and tremor, diffuse rigidity, and in reflexes it is increased in serotonin syndrome and decreased in NMS. And pupils, it is mydriasis, that is dilatation of pupils in serotonin syndrome, and normal in NMS. So talking about step 3, there are triad, obviously, CNS, autonomic, and muscle hyperactivity happens, and that if in severe cases leads to seizures or rhabdomyolysis, right? And then drug interactions are the primary triggers for this, and the clinical manifestations of serotonin syndrome is that it can be mental or autonomic. In mental, it is anxiety, agitation, confusion to coma, right? And in autonomic, it is tachycardia to hypertension to hyperthermia to diaphoresis, that is excessive sweating. And in neuromuscular, it is tremor to hyperreflexia to clonus, that is in ankle, and to rigidity or seizures. And the other symptoms are nausea, diarrhea, which is also leading to free to breathe in rare cases. And the POL is that hyperreflexia, and clonus is diagnostic of serotonin syndrome. So that is all about serotonin syndrome. Subscribe for more clinical polls, and thank you for staying with me. Thank you.